Thank you, ladies and gentlemen, for tuning in today. Today, we are going to talk about self-medication, and I will talk about it in a general way, and this will be in response to a question that has been asked by many of you after watching the last video. I would not want to complicate matters here, but I would want to tell you in a simple term, self-medication simply means using medication without the advice of a health expert. It is to say or to mean that you are treating yourself or you are using medication for a perceived disease status or condition. Many people have asked me the reason I emphasized on issues of self-medication and why I was against them. Yet, many of them have raised the fact that there are certain conditions where they don't necessarily need to see a doctor or a health practitioner for them to get treatment. So, I'd want to say that when it comes to health-related issues, the aspect of decision making is very important. It is up to an individual to make a decision that is right and that is well informed. I would highly emphasize the fact that use of medication without advice or input from an expert or a health practitioner is not a good practice. And emphasis should be put especially on medications that require prescription. For over-the-counter medications, like the usual painkillers, like paracetamol and the rest, can be purchased over the counter and they can be used to treat simple ailments like pain. All in all, even if these medications are used for such simple ailments, there is a requirement that when you use this medication for a given amount of time and there is no proper response or there is no change to your condition, then you seek medical advice. Ladies and gentlemen, I can see that we have got more than 5 people that have insisted I talk about the issue of self-medication and to clarify the position and hard stance that I have taken in regard to that matter. There is also a large group of people, around 15 of them, that have agreed to my sentiments, especially in regard to use of artemether-lumefantrine. I want to tell you this. Drugs are good, but drugs are also bad. Another name for drugs is poison. That simply tells you that it is not something good. It is good because it helps treat, it helps prevent, it helps mitigate the effects of a disease, or they can also be used to diagnose. But that is good if drugs are used for that purpose. And we shall say that they are good to be used for that purpose if there has been involvement of key stakeholders while arriving at that decision. That is to mean there is a patient, there is a healthcare practitioner, there are other stakeholders that have helped inform us on a certain decision, especially on use of medication. I have just said that drugs are poisons. Let that not send an alarm to you. The reason I chose to use that word is just to help you know that, or just to prod your mind with the fact that as much as drugs are good, they are also bad. When drugs are administered to the body of a sick person, or even if not sick, what usually happens, they are absorbed in our body system, they are distributed to the various parts and organs of our body, that is through the systemic circulation. They are then metabolized, whereby they are converted into readily excretable substances, and after that they are eliminated from the body. That simply tells you that there is a beginning and there is an end. There is an entry point of a drug to the body until that time when it exits. And that simply tells you that a drug takes a certain amount of time inside our body. And that is to mean there are a lot of chemical reactions that take place in the body, whereby the drug is being converted from one molecule to the other one. It is being modified from one form to the other. And as these chemical reactions are taking part inside the body, there are products that are actually formed that usually have an impact to the body organs, our vital body organs, where the liver is involved, the kidneys are involved, the lungs are involved, the heart is involved, and many other vital organs within the body. And as these chemical substances are reacting with the system, definitely they have an impact or an effect which may either be desirable or not desirable. In other words, we say that drugs are used for unnecessary evil. Though they may hurt the kidney or they may hurt the liver, but they may tend to produce an outcome or an effect that is desirable. Let me explain. For example, if you take an antibiotic today because you want to treat a urinary tract infection, and in the process of taking this medication, as it is being metabolized inside the body before it is completely eliminated, it interacts with the enzymes of the liver, and in so doing has an effect or a damaging effect, in this case, to the liver. That is to say, we want to relieve your infection, your bacterial infection. But in the process of relieving your bacterial infection, we are hurting the liver. And that is why you see drugs are given in doses, and there is usually a schedule on how these medications are need to be taken. And that is why I said the involvement of an expert is very key. Very key, because patients usually have other medical conditions. Patients usually have got are already on other medications, and so a health expert will help you understand, as you're using medication, they will tailor make it to suit your condition. So I want again to emphasize and answer that question of self-medication and say, please, self-medication contributes negatively towards our healthcare system. That is to say, when drugs can't treat effectively because of resistance, then it becomes expensive to a country. It becomes expensive because new moieties or new drug substances need to be developed. And development of a drug is not a simple process. It takes a lot of time, it takes a lot of years, there is a lot of testing, clinical and non-clinical. There are a lot of researches that go on for a drug to be approved to be used in human beings. So the process is usually very expensive. And that is just to say, if self-medication contributes to drugs developing resistance, then it could be a good thing, or we could be advised to stop self-medication so that we don't walk the difficult route. It is safe also for a human being or a patient not to overexpose themselves to medications. These are chemical substances, as I already informed you. They are poisons. The moment the body gets exposed for a long time to these substances, then the harmful effects of these drugs are even more. I want to state that if there was no self-medication, then many of the drugs that we use today that are cheap and are readily available could be very important and could reduce the burden of or rather the expense that a country uses in terms of doing research and development to come up with new drug moieties. It is also safe for individuals, for human beings, to reduce their exposure to medication. And that is just to mean use that medication with the involvement of a drug expert. The issue of self-medication shall be handled elaborately in the next video. Please go to www.dr.shamalla.co.ke where you can access more information, whether in written or in video format, that will help you make informed decisions, especially when it comes to health-related issues. You can also engage with me, ask questions that you need clarity. You can also give your contributions, and we can interact so that we make not only our country, not only our continent, but the whole world a better place, a place that is good to live. Because as I said in the last video, SDG number 3 talks about well-being and health of everyone that is living on the planet Earth. So I would request we all take part in achieving this status. Thank you very much, and meet you in the next presentation.